So we are going to stay on time as best as possible, but make sure also that you have all of the critical updates and you can, again, hopefully leave this discussion feeling equipped with an understanding of where we are, because we have absolutely progressed. So let's jump in. Starting with our campaign overview, it's so critical for us to stay grounded on our guiding principles, particularly with the new vaccine coming in, understanding the safety of it, also not losing focus on our prioritization of minimizing deaths and hospitalizations as much as possible. And then, of course, doing it efficiently and expeditiously while keeping access and equity at the foundation of everything we do and staying vigilant about doing that. If we slip, we do what we need to pull that back and stay founded on that core principle. For our phase 2 guiding principles, it just expands with the focus on the minimizing more hospitalizations and deaths and continuing the equity piece and getting us set in terms of moving towards a reopening the economy vision. The next slide gets into what our 3 vaccines entail. We now have 3. The Johnson & Johnson vaccine, which I'll go into a little more detail on. The most important message you can take away from this discussion with our 3 vaccines is that they are all equally highly effective at preventing hospitalizations and death. You know that there's information out there about differences in effectiveness. That's more so connected to spread of disease. But knowing that our focus in this state is on keeping people alive and keeping people out of the hospital, all 3 vaccines do an excellent job together at achieving that. So again, with phase 1, we focused on being extremely precise. Having the very limited vaccine we had at the beginning, we wanted to make sure that we really focused in on those populations that were at highest risk of hospitalization and death, as well as the people who cared for them. That meant, with being more strategic, with being more targeted, that we were slower through that first phase. There was a lot of frustration appropriately expressed because of that during the last time. We have since shown, through that time and now, that the intention of doing that achieved what we wanted to achieve, because we continue to lead the nation in the number of hospitalizations that we have reduced by. Other states are now starting to catch up, but we have had that reduction first, more than any other state and the national average. And since then, as discussed the last time, we have significantly accelerated our rollout as a part of phase 2, which was the plan. Get faster, take an age and underlying illness and geography-based approach that would allow us to go faster. And we are now among the highest vaccine administration rates in the country. So I'm so grateful to be able to tell you what we were planning to do last time and to have a team that speaks for itself now this time. All that being said, our vaccine supply continues to be limited. Hopefully not for long, but it is. So where we are now in our timeline in terms of the schedule is exactly where we intended to be when we rolled out this schedule several weeks ago. We did not fall behind. We're actually doing our best to stay in front of it, even with additional elements added to the process. So we have opened up to those 65 years of age and older, and we had for the plan of mid-March to go to 60 and older and those with underlying illness. And as we get additional vaccine, we plan to accelerate all of the subsequent eligibility timelines that we can. So to be able to give a sense of how we are expanding so rapidly and successfully in terms of administration rates. We have opened 3 state-run vaccination sites that are focused on volume, minimum 5,000 individuals a week, hundreds of individuals per hour that can be vaccinated going through those sites. And we have 2 potential sites that we are looking to roll out before, mid-April timeframe, if not sooner. So jumping into some of the data updates, again, as of March 9th, we are ranked 6th in the nation in terms of states, 4% of people who have been vaccinated with at least 1 dose. That speaks for itself. It addresses what the concerns were expressed the last time, and hopefully gives you all the confidence that although it seemed like it was a mess and, things are all over the place, there was a strategy and a plan. We accomplished what we wanted to for phase 1, and we're absolutely doing what we plan to do for phase 2. So that confidence is something you can continue to take with you. Again, looking at what has been accomplished due to our approach with phase 1, we've had a 73% drop in our positivity rate, a 75% drop in our hospital admissions, which is leading the nation, and an 89% decrease in our fatalities since the peak has occurred. It's important also to know that vaccines have contributed to this significantly. The next slide will show that, but it is not only vaccines, because on this previous slide, I was trying to say but quickly so I would catch you before you moved. I knew you would, because you're on it. Thank you, Neil. In addition to vaccines, we have focused on testing, treatment, and vaccinations. And everything you all can do, equipped with this information to help remind people and ensure that everyone understands vaccines is one of a 3-pronged approach that's going to make us successful. It is not the only approach. Testing, we have been leading the nation for months. That's what gave me the confidence that we would certainly be able to return to you with similar effects with vaccines. And you just needed to be able to see that, as you see now. We have been able to maintain the level of output, throughput with testing that many other states haven't, mostly because people are just starting to get tired. So you all can continue to contribute to that by ensuring, I am still saying, even with vaccines, get tested as much as you can. The risk of a spread is much lower with getting vaccinated, but spread can happen. And because we have not vaccinated the entire population yet, getting tested helps in identifying and changing behavior on how you can protect from exposing someone else who may be vulnerable. I really want to emphasize the treatment piece. Monoclonal antibodies, MAB, is a viable treatment that is effective at keeping people out of the hospitals, intended prior to someone even being hospitalized so that they don't need to be hospitalized, so they can start to improve. It is an intravenous infusion, and we're doing everything we can from beginning to end on our end and with our partners to really push on the treatment piece, particularly as we're trying to ramp up the rest of the population getting vaccinated. The one huge tool we also have to keep people out of the hospital and keep them alive is treatment. So any help you can provide in getting access to treatment, maybe someone from our team can put in the chat what information you can use with your constituents so that folks know how to get access to treatment if they qualify, being 65 and older, or someone with underlying illness who is COVID-19 positive and has symptoms. Every single individual who falls in that category should get treatment. Okay, let's keep going. Our vaccination rate has continued to increase. We've administered over 330,000 doses, and our administration rate this month is increased 170% compared to our administration rate just in January. And it's increased 25% from what it was in February. So we will continue to push on that as vaccine is available to do that. This also highlights in a very quick way that while we say it's testing, treatment, and vaccination, we do have evidence that shows for our phase 1 targeted, slower, but precise approach, we have dramatically increased or dramatically more striking drops in cases, hospitalizations, mostly, and some fatalities in those populations that we really focused on during phase 1. You can actually see the difference when you compare the populations we focus on: healthcare workers, long-term care facility residents, Central Falls residents, and those age 75 and older. The drops in cases and hospitalizations in particular in those groups are more than in the other populations, definitely showing the impact, thank you, Sophie, that our vaccination approach for phase 1 had. Okay. It's very helpful to be able to share with you. The red bar is a 65 to 74-year-old population, and the blue bar is a 75-year-old plus. We have, at this point, vaccinated 71% of those 65 and older, and 74% of those 75 and older. Is there anything needed to mute that? Are you all hearing that, or is it just me? Okay, so a general approach with herd immunity is to have at least...
It's very hard to hear you. There's some kind of static.
Do you think it's my phone doing it, or is that someone else who's on State House Live Feed 101? Yeah, I think that's someone else. Chairman, any suggestions?
I think it's the State House feed.
There we go. It's off now. Let's see.
Okay, got it.
So
So this slide is basically saying we have vaccinated over 70% of our 75 plus and 65 plus, and 70% is what our target is for the entire population. So we are well on our way. Next slide gives you the age group breakdown and just shows how we are continuing to evolve from phase 1, what our focus has been through phase 2, and as we're expanding beyond that. And then the next slide gives you our race ethnicity data, which shows we have a lot of work to do to improve this. The reddish maroon color is referring to those who are Caucasian, and it is well over 85% of them have been vaccinated. And our purple is Latino, orange is African American, and like violet, light shaded purple is those who say other race. All of them are just way too small because you can't even see those colors, and it is among communities that are disproportionately more impacted by hospitalization rates in particular and cases. So this is flipped from what we need to really be focusing on, and it's what we are holding ourselves accountable to correcting. Okay, so to quickly get into vaccinating teachers, school staff, and child care workers, that is starting tomorrow. It is in connection to our municipalities. We have the doses to cover the majority of that group so that we can keep the rest of the eligibility rollout on schedule as planned. And the thing I will just ask all of you is to help us in ensuring that our child care workers are really prioritized and included in this rollout, because we definitely have our teachers and school staff. We do not want our child care workers to be forgotten. So if you can help with that message, that would be great. And the next slide just goes through a little bit more of who is eligible. Is really focusing on where people work. And the cities and towns are the ones who are going to contact individuals. Providence has a unique setup because that group is so large. And again, really helping to promote that our child care workers are included with this is appreciated from you all. Our next slide goes into what our high density community strategy is, knowing the gap that I shared earlier. Health equity is, as you know, a critical focus for us in RIDO. We have really hunkered down on how we can accelerate what's needed here. The work that was done in Central Falls was effective, it was successful, and we need to replicate it and expand it quickly. So we're starting with the 2 zip codes in Pawtucket and the 5 zip codes in Providence, focusing on the Providence side of 04 and 05, where the rates are higher. And we're taking a variety of approaches that mirror what Central Falls did effectively. So that includes going to 18 plus in specific venues. It includes going to earlier age groups across the vaccination sites. So the Providence side of 04 through 09 is currently vaccinating 50 plus, and then expanding with providers as much as possible and as supplies last, or supplies allow, I would say. And we have a robust approach which was built from what has worked successfully and what we need to apply in the additional HCC zip codes. And the next slide, coming towards the end, focuses on the Johnson & Johnson vaccine, and basically is to let you know that we have incorporated it across our channels so that it's understood. The best vaccine to go with is the best vaccine is available to you. And we're making it available every place that we're able to. There were 9,100 doses originally allocated. We were not expecting more for 3 weeks. We'll see if the federal government changes that, as they have told us they would. And we have distributed it across all the channels with the way for Rhode Islanders to be able to choose which vaccine they would like to take. And the more you all can help encourage, every one of them are advantageous, the better to get it distributed. And I believe that is it.